I've got 3 slides and 3 recommendations for future research priorities. This first one is basically, if you're going to go through all the effort of designing and doing the study, measure the costs, please. We need to know much more about this. Dan has been through this process with me, so he can comment realistically on how much hassle it is or not. But it's also worth a lot. And the original quote here was variously attributed to Peter Drucker, Lord Kelvin, and Deming. But the bottom line is, if we don't start measuring costs, how are we going to ever do anything about the healthcare cost crisis? And how can we become more efficient in how we deliver our healthcare? And so that's for that one. Okay, so number 2. Basically identify and target this high-impact chronic pain group. This is not a difficult group to separate out. It would probably help understand some of the differences in outcomes seen across studies. That's where the biggest bang for the buck seems to come, and this is the group that is suffering the most. So that's really, and then also the modeling work where we were able to carve off those groups in those different studies, it seems to show that some of the therapies are better than others for those with high impact chronic pain. So not that much more effort to look at that, so worth doing. And the third one here, I love this quote about modeling because you can get into so much of the details, and so there's this, this tendency and wish for it to all be true, but frankly, essentially all models are wrong, but some are useful. So basically, the models I showed you, they're wrong, but hopefully useful in that you can, once you get something modeled like that, you can start to look at things in relationship to each other and carve out certain groups to look at. And so it's a very useful process, and it can help balance the baseline samples. It can simulate experiments, tell you where to spend your time for your next trials, and it allows the inclusion of economic outcomes even though they're not measured. And ha!